Hello, everyone. Welcome again on the DECA webinar series. This time, the webinar is about tips and tricks about the cool waves and the action on fat cells and collagen. We will focus specifically on how to maximize the effectiveness. The official language of the webinar, as usual, for both the presentation and the question time is English. Our speaker of today are Professor Paolo Bonan, ESLD Key Officer, EADV Laser Task Force member, and Adjunct Professor of Laser Plastic Surgery, University of Siena, in charge of Laser Cutaneous Cosmetic and Plastic Surgery Unit at Villa Donatello Clinic, Florence, Italy. Other speaker is Dr. Michela Troiano, dermatologist, assistant at Laser Cutaneous Cosmetic and Plastic Surgery Unit at Villa Donatello Clinic, Florence, Italy. During the entire webinar, you can ask questions by acting on the push button that you find aside the screen. The answer will be mostly answered right away, and in case of too much questioning, they will be eventually answered in the next days by our speaker, Professor Bonan and Dr. Michela Troiano. For questions instead relating to technical and logistic details instead, the answer will be promptly answered by our team. Let me give the word now to our first speaker, Professor Paolo Bonan. Enjoy this webinar.
Well, good afternoon, everyone, and welcome back to those fellow physicians who are with us for the first two webinars, and a warm welcome to those attendees that join us today for the first time. As we prepare to step into the new topics, I'd like to take you back a couple of steps, reminding you that so far we have seen the DECA suite of CO2 and Motus pieces of equipments in the treatment of various cutaneous conditions, and had made possible for all of us to treat, improve, and resolve many clinical issues like rhinophema, dermal nevi, sebaceous nevi, photoaging disorders, pigmentations, telangiectasias, and vascular anomalies, to name just a few of them. Today's webinar focus is instead on the microwaves, or better, Onda cool waves, and its powerful ability to reduce the stubborn fat that our patients have always aimed at eliminating, and to compare the system with the other procedure in the market. They are not so effective and with the potential risk of drawbacks. Before delving into the core of the webinar, let me thank once again Engineer Paolo Salvadeo, Dr. Giustino Gallo, all the area manager, Irene Bini and Joanna Norgren, Vincenzo Di Mello for his important technical support, but allow me to express my gratitude to Federica Colli, an important member of my staff, for her invaluable help and contribution in the technical development of this new platform over the past 3 years. Without further ado, let's start with today's agenda. It's on cool wave section on fat cells and collagen. How to maximize their effectiveness with Onda. Well, Please, I kindly ask you not take picture on clinical images for the privacy. And as we have a complex matter, allow me to divide this introductory part of the presentation into short chapters in order to be more clear with it. Starting with the substrate, the main target of Onda is the adipose tissue. That is truly complete organ, is a functionally active tissue and is characterized by three main elements: the adipocytes, of course, and fibrous trabeculae and blood vessels. Is 50% in the subcutaneous connective tissue. This is our target, where we have to focus our treatment. We have three types: the white adipose tissues with the function of energy reserve, accumulation, and release of fatty acid in the circulation; the brown, that is the cold-induced thermogenesis, very rare in adults, only in some areas; and the beige adipose tissue, or bright brown and white, that is the role of recruitment, the brown and white in a scatter in the white adipose tissue. Well, the adipocytes are characterized by the inner presence of inside of a large lipid drop, which causes the nucleus to be crushed on the periphery and the cytoplasm reduced to a thin ring, which wraps a single large vacuole without a membrane. This is very important. We'll see later on. And please, let's look to this particular area, the peripheral part, where we have the basal membrane that is typical of the adipocytes. It's unique and connects the adipocytes with the connective. It's a very important area where we can focus a part of our process in the mechanism of action. In the market, we have a crowded present of devices, but most of them are not capable to reach the fat because of the frequency. They can have a very good tightening of the skin, but not capable to reduce the starboard fat, as we can do with our Onda. The surgery has advantages represented by the efficacy, of course, but disadvantages represented by the fact that we are invasive, expensive, and need a strong motivation. 3 years ago, we were looking for a new system, easy to use, extendable to all body areas, effective on adiposity, cellulite, skin laxity, easy to propose to the patient, and with a minimal risk. Onda arrived in our market thanks to DECA, and is a body-shaped system delivering special microwave energy through special end pieces, targeting fat, cellulite, and laxity. Why microwaves? We know that microwaves are present in nowadays in our daily life, from the radio astronomy, mobile phones, to the microwaves oven. But actually, microwaves are one of the first insights about stimulated emission of radiation. It was the precursor of the laser, microwave amplification by stimulated emission of radiation. Charles Towns won a Nobel Prize in the 60s thanks to this energy. So it's very fascinating to find that the roots are found in the past very often. Definition. You see that the microwave is an electromagnetic wave with a wavelength shorter than that of a normal radio waves, but longer than those of infrared radiation, where we can find even laser. In particular, in the far infrared, we can find CO2 laser. The range in terms of frequency is from 1 gigahertz and 100 gigahertz. This is very important and crucial to understand the mechanism of action. Let's have a look at this interaction with the biological tissues. You see that this kind of energy creates a heat in a specific part of biological tissues, not everywhere. Fat is more likely to generate heating in the gigahertz domain rather than in both megahertz or kilohertz regimen. Two important parameters are important in the tissue interaction: electric conductivity and permittivity. The first is referred to the energy transfer, and the second in the energy absorption. Skin with at 2.45 gigahertz, the emission of Onda has low permittivity, so less absorption, but high conductivity. But in the fat, we can concentrate our action because there is a high permittivity. So is a very effective for fat reduction, cellulite, and safe for the skin, as we'll see later on. You see this bar chart, you can appreciate at 2.45 gigahertz the great absorption at this kind of frequencies in the fat and very, very low in the skin. The skin is like a sort of a glass slide, a glass layer that allows the energy to pass through and reach the fat and concentrate the energy there. This is one of the example, cool ways compared with the traditional radio frequency. The traditional is capable and to exploit this action only in the very superficial layers in the skin with a good tightening, but not capable unless we reach so high energy to burn the skin. We are not capable to heat the fat in depth. We can do this with the cool waves. Dipole. What does it mean? The dipole is like a compass needle with a positive and negative poles. The dipole is polarized molecule caused by the different electronegativity of the atoms that bind to form it. The covalent bonds that are formed are therefore polarized and can cause a polarization of the entire molecule. You see the difference of the polar molecules in dielectric without electric field and with electric field. You see the molecules are oriented in the same direction of the field. What happened in our tissues and how in the adipose tissue? You see that in the frequencies of microwaves, triglycerides can be seen as dipoles. Triglycerides consist of a single glycerol molecule and 3 fatty acids. Triglycerides absorb microwaves more than other molecules inside the adipocyte. Triglycerides try to get oriented following electromagnetic fields orientation like a compass and generate heating at approximately 50-55 degrees that impact on its chemical ester bond. The dipoles, triglycerides, try to get oriented to microwave field direction. There is an intracellular heating generation and the thermal separation of triglyceride in fatty acid and glycerol. So as a consequence, we have a compromised homeostasis. You see that adipocyte alert to regain homeostasis. There is a sort of uncoupling between the two processes of oxidation and phosphorylation, and we have a really oxidative stress with alteration of the permeability of the membrane. After the treatment, you can see the so-called intussusception, so the endocytosis of the fatty acid in the cytoplasmic membrane, followed by the exocytosis. So the droplets go out in the surrounding connective tissue. And we have the so-called blabbing effect. The blabbing effect is a sort of onomatopoeic term due to the fact that you see in vivo preparation, histological preparation, you see the typical droplets in the peripheral part of the adipocytes, and is due to the fact that by focusing with the optical microscopy, you can hear easily the blebbing, so the production and the exocytosis of these droplets in the tissues out of the single adipocyte fixed in osmium. We publish some papers. I'm talking about me, my group, other groups in Italy, with great satisfaction, because this is one of the first that we published 1 year ago, and other publications. You see here some of this, and I'm really proud about this because it's just accepted and is undergoing to be published. Is about combined microwaves and fractional microablative CO2 laser treatment for postpartum abdominal laxity. We noted the great improvement and enhancement of the tightening in the skin in the postpartum abdominal laxity. And this combination is an incredible tool for us to get a firmness in our skin. Why dynamic? I'd like to call dynamic histological study because thanks to Professor Caligaro in the study of Vietnamese pig, Professor Caligaro was able to follow all the steps before and after the procedure, even at 2 months post-op. So we have this possibility to follow the entire process. You see the adipose tissue immediately after the treatment. We have adipocytes rupture and vessel hyperemia. Blast vessel dilate to try to take away the accumulated heat. Then we have the so-called exocytosis with the blebbing effect. And you see, compared to the normal mitochondria become swollen. So, and there is a matrix rarefaction. Even the granular endoplasmic reticulum ribosome gets dilated. And you see that 6 hours post-treatment, adipocytes is not able to sustain this excessive metabolic process and undergoes metabolic stress with a membrane rupture. This is a very astonishing image, and I want to thank Professor Caligaro for that, and is a chemotactic action of monocytes against interstitial extracellular lipids, not esterified, supplied by stress adipocytes. You see that we have the first recognition of a free extracellular lipid drop with the star, the orange star, from a single monocytes. Our body is capable to deliver a signal, a chemical signal that is called find me. And thanks to this, we have a sort of beginning of a sort of immune response that attracts monocytes, equipped with the chemotactic receptors against free fatty acid. The monocytes will later merge with each other, forming multinucleated macrophages. So this is a very important process. I want to highlight this part of histological sample because this is crucial. We have seen the increase and alteration of the membrane permeability. We have seen the oxidative stress, but what is important is this fantastic attraction by the droplets of the monocytes. Monocytes arrive, and you see the molecules that allow us to be very effective because they attract the droplet. And you see here in the first image, you can see monocytes interstitial present. In the point 2, in of single monocytes surrounding a single adipocytes, and point 3, macrophages, so the phagocytant monocytes, crown-like located around the single adipocyte, represent and create a crown-like structure formation just around the droplets. Another astonishing image thanks to Professor Caligaro. It is an important dynamic process that we have in the tissue after that the energy has reached the adiposity and the molecules of the triglyceride are heated by this energy. Then the process is in the membrane. There is exocytosis and the monocytes and macrophages that phagocyte the droplets. Well, where do macrophages end up at the end? You see lymphatic system. In the image, we can see a lymphatic vessel, Y-shaped, you see, branched between 3 adipocytes containing macrophages rich in lipid drop. So the pathway is the lymphatic system and will be eliminated with our system of the body or during the following days in 2 months. And histologically, what happens after? You see, 2 months post-op, the treatment, there are no signs of inflammatory infiltrate. You see the infiltrate that I showed before in the red box, and actually the connective septas that are restored and no signs of inflammation here. Here again, you see there is a reduction in the number of adipocytes and fibrous strands that is hypothesized. The fat thickness reduction are appreciated through a sonographic examination, many sonographic examinations that have been done and performed. This is a very important ultrastructure analysis. You have seen before the swollen mitochondria and the activation on rare and the production of reactive oxygen species. Now, after 2 months, we have a restoration of ultrastructural cytology of adipocytes and the normal, apparently normal, interstitial connective tissue. Summarizing, macrowave acts on triglyceride molecules. Triglyceride molecules split into glycerol and fatty acid. Adipocytes homeostasis is compromised. There is a hypermetabolic reaction with ATP and reactive oxygen species. There is an increase and alteration of membrane permeability. Fat exocytosis before intussusception, then exocytosis and macrophages action, adipocyte elimination by lymphatic involvement and pathway, and then the restoration of the physiological homeostasis. But we have other targets. We discovered by chance because at the very beginning, we were concentrated in the fat and in the reduction, elimination of the fat. But then we discovered across by some pictures that there were other targets and an improvement, for example, of the cellulite, edematous fibrosclerotic panniculitis, and even the cutaneous laxity. Cellulite responds well to all stages, except for the first stage cellulite, the edematous component of which is very evident. Therefore, rich in water, which eats up, but doesn't get drained. So it's important to have a manual lymphodrainage. Cutaneous laxity in all body areas, except for the face and the cardiac regions, areas on which microwave treatment is not yet possible. But now, yes. Why? About cellulite, we know that is characterized by vertical septa and vertical wall of fibrotic connective tissue. But after cool waves, we can have an improvement, especially in grade 1, 2, and 3. So in advanced grade of cellulite, for the reason that I explained before. And you see another interesting image that I thank once again, Professor Caligaro. Now we pass in the fibrous strand from the old collagen type 1 to the new collagen type 3. And he have used a particular staining that is called Picro-Sirius red that allow us to evaluate the old one in green yellow to the new one in the blue red. And of course, a polarized circular microscopy. So about the cellulite, there is a normalization of the area. There is a collagenic septa solubilization, fat melting, a sort of fat melting due to this elimination of the droplets and the phagocytosis of the macrophage, new collagenic septa formation, inner pressure normalization, and pain management improvement. But what about the skin? The skin is tighter. There is a firmness skin. Why? Collagen fibers shrinking, we can see. There is the extracellular matrix reorganized, neocollagen elastogenesis, and peripheral structure normalization. As a consequence, skin tightening. Because as you can see here, but Dottoressa Michela Troiano will explain you, there is, in the first instance, the energy passed through the skin. But then after we have focused the action in the fat, the heating is recalled back by this particular end pieces that is capable to cool down in the ring the skin, so to preserve and avoid any risk of side effects. But we can recall back, and there is a sort of upside down thermal injury. From the depth, you can heat the skin and get the tightening. You see the skin histologically before and after. The last important concept, this kind of energy focus on fat without damaging the surrounding tissue. That's very important because if you compare, for example, with IFU, we don't touch the muscle and bones. So taking in mind the great selectivity of this energy, the great efficacy, and the capability to target different points, different areas of our body. And with this last slide, I give the floor to another precious member of my team, Dr. Michela Troiano. I really thank you for being here with us today.
Thank you for the explanation, Professor Bonan. Now, actually, part one of the webinar is going to end, and the second part of the webinar is actually beginning in a while with the new speaker, Dr. Michela Troiano. What is actually pointing and attracting the attention of the Onda technology is actually mostly concentrated in what is the action towards the single triglyceride molecules. And this has been giving us the opportunity to develop also other methodologies that now Dr. Michela, in addition to all the clinical results that she will going to outline for us, she will details in a few while. So I'm leaving the word to Dr. Michela Troiano.
Well, thank you, Simone, for your introduction, and thank you, Professor Bonan, for the detailed descriptions of the changes of those changes that happens in the fat cells, and even on the other layer of the tissue, and which explain the triple action of Onda. So let's start with the practical part, starting from a perfect comparison, perfect example of that can help you to understand better the mechanism of action of Onda. Professor Bonan spoke about the several microwaves technologies which surround us in our everyday life. And in particular, he mentioned the microwave oven. The microwave oven works in a very similar way to Onda because, and I think that most of you are familiar with the microwave oven. So when we put a cup of milk or, for example, a piece of food inside of the microwave oven, the temperature of our milk, of our piece of food, will start to increase while our cup will remain cold. This is what happened at the beginning, but after several seconds, even the cup will start to become warm. And this happens because it's not induced by the microwaves, but because it's conducted by the heating of the milk according to the first principle of thermodynamics. What happens when we use Onda is something very similar to what happened when we use the microwave oven. In this case, our target is represented by the fat, and our container, our cup, it corresponds to our skin. And that happened because we are working in a particular domain of frequency. We are working at 2.45 gigahertz. In this particular domain, our tissue have a particular behavior. So the skin has a very high conductivity, as Professor Bonan told you before. This means that the skin has a very high capability to be passed through. So it appears transparent to the passage of the microwaves. On the contrary, the fat has a very, very high permittivity, which is the capability to store the energy, so to absorb the microwaves. And it's here in which we'll have the generation of the electromagnetic field. So the generation of the heating, but this heating does not stay still in one point. So it will start to spread, and we'll see it will reach the dermis and epidermis. But the fat, thanks to the high permittivity, permits to the microwaves not to cross the fat. So for this reason, the system is particularly safe because no vital organs will be involved. But despite the microwaves oven in which the delivery is under control, let me pass this word, is a wild way of transmission because the microwaves crash against the metal walls, and whatever they do, wherever they go, we don't care, because in this case, we just want to heat a piece of food. In the case of Onda, the transmission must be controlled. And this happens thanks to two electrodes, one which is in the center of our end-piece, which push down the microwaves inside of the fat layer, and a second electrode which recalls back the microwaves. So the system, you see, is a very has a very controlled delivery, and you can see from the pictures that we have a very, very close circle. So we are sure that the transmission starts from one point, it reach a certain depth depending on the end piece we are using, and it will hand to the other electrode. But this heating that is generated on the fat layer does not remain still in one point. So it starts to spread. It takes two directions. The first direction is in the horizontal layer. So we will have a spreading around the fat layer that is not being treated. So that's why we will have an improvement even of the adjacent area to the treated area. And it also comes up to the derm, involving the dermis, involving the epidermis, And so that's why this heating will permit us to thermally solubilize the collagen, and in particular, collagen type 1, which is the more hard collagen, and it will stimulate collagen type 3, which is more elastic, and so we'll have an improvement in cellulite. And going up to the superficial dermis, we will have even an improvement of the skin quality. But this heating is an heating which is around 55 degrees. So it's a good temperature for the fat, but going up to the superficial could damage the tissue. So that's why we have on the top of the periphery of the NPs, we have a cooling system. This cooling system, it's able to, it's normally set at 5 degrees, and it's able to cool down this temperature. So at the end of our treatment, after 12-15 minutes, the cooling system at 5 degrees will be able to dub the rising in temperature. So at the end of our treatment, we will have a temperature which is around 42 degrees. And this is a good temperature for improving the skin quality. That's what can happen if we stay still in one point. So you don't have to do that because it could be very dangerous. But if we stay still in one point, the yellow and red area correspond to a temperature which is around 75 degrees, while the green area, it corresponds as a lower temperature, and it corresponds to the cooling system. So it's important to reduce the temperature that is coming up. For this reason explain two important points. First, we have to always to slide our NPs on the tissue, because otherwise we could damage. And second, we have to perform not circular but linear movements, because making circular movements, we are not able to dub the temperature in the right way. We have two different NPs, a shallow NPs and a deep NPs. Both of them can treat the same blemishings, but the shallow NPs, it's able to reach 0.7 millimeter. The deep NPs is able to reach 1.6 millimeter. What does it mean? So how can I choose my NPs? It depends on the plica that I have to treat. So if I have a plica which is less than 2 centimeter, I will use the shallow NPs. If I have a plica which is more than 2 centimeter, I will use the deep NPs. But normally, the shallow NPs, it's used for the treatment of skinny patients to improve the skin quality. It's used for the treatment of the arms, because in this area, we do not find a correct coupling with the skin if we use the deep NPs. And it's used for the new field of application of ONDA, which is the submental area. And attention, it's used for the treatment of fibrocellulite. So when we have a very fibrous cellulite in stage 3 and 4, instead of using the deep NPs, we will use the shallow NPs. Why? Because the narrower parameters, the narrower diameter permits me to concentrate my energy power, and so I'm sure that I can denaturate the collagen. Recently, these end pieces have been redesigned to be more ergonomic, lighter. There is a 90s lining wrinkled material, and we are able to guarantee a better coupling. And recently, even the software has been uploaded, and this permits me to work with very low parameters and to treat a particular area, such as the submental area. Well, in detail, our MPs is characterized by a presence of the two electrodes, which I mentioned before. So we have a shallow, the shallow end piece will reach a depth of 0.7 millimeter, and then the second electrode will recall back the microwaves. And the deep end piece instead will reach 1.6 centimeter, and then it will recall back from the electrode. So the transmission is safe because no vital organs there will be involved. It's safe so for the patient, but it's also safe for the physician, because even if we carelessly we lose the contact with the skin, we are sure that the microwaves will be recalled back. There is also a system which permits us to control the emission. There is a LED light, which is in the proximal part of the end piece. So this LED light can be red. It means that we are not in contact with the skin. It can be yellow. It means that we are delivering half of the energy, so we have to fix our position. And it can be green, and it means that we are working in the right way. Well, the treatment is pretty simple to perform. It's really important to draw at the beginning the area to treat and to select in the correct way the area to treat. Because what is important, I want to remind you, is that the area which is around our square 15 by 15 will improve. So it's not necessary to perform squares very, very close together, because we can take the advantage. So because we will have the improvement even on the adjacent area. And this is the area in which we have to deliver the right dose with the right power. It's important to know that no more than 6 squares can be performed. And this because Professor Bona told you the system which is responsible, which is able to eliminate our lysate, is the lymphatic system. So we don't have to stress too much the lymphatic system. How many treatments? Well, it depends. It depends on the body type. So if the patient is a normal type patient, we normally perform 2-3 sessions. If the patient is an overweight patient, we will perform 4-6 sessions, but an average of 4 sessions. How long should we wait between each treatment? This is a very important point, because in order not to stress too much our lymphatic system, it's important not to reschedule our treatment before 4 weeks. This is when we have to treat fat and cellulite, in which we'll use very, very strong parameters. So normally, the treatment will be rescheduled after 5 weeks. In case, instead of skin laxity, in which we normally use the shallow end piece and we normally use lower parameters, the treatment can be rescheduled after 3 weeks. For the treatment of the submental area, the treatment will be performed after 2 weeks. In order to help our lymphatic system to work better, we can suggest to our patient to perform lymphodrainage massage and to drink water. It's important to use only paraffin oil because it's the only consumable for the machine, so no gels, no creams, because they can contain water and the water absorb the microwaves. So we can have an energy scatter on water component. But in this huge scenario of system, of platform for body contouring, why should I consider Onda the best device for body contouring? I think that the most amazing aspect and innovative aspect of this device is the triple action. And we can have this triple action using the same platform, using the same NPs, using the same parameters, and in the same time. And this is great. Maybe someone of you have platforms that can have more than one source. In the past deck, I had Triactive, for example, and even in this case, we used to say that had a triple action, but we had to plan, for example, 8 sessions of ultrasound, 6 sessions of radio frequency, some other sessions of laser. So we had to plan to our patients a very, very long and expensive path for our patients. So I think that the triple action is the most amazing aspect of this system. But let's see the difference with other systems you are maybe familiar with. First, radio frequency. The radio frequency you find on the market can be divided in monopolar and bipolar. The monopolar has a good depth action, but the problem is that the current flows through the body from the active electrode to a return electrode on the lower back of our patient. So it's a procedure that will improve the skin tightening, but at the same time, it's not particularly safe. The bipolar technology instead is a system which is nice for skin tightening. The current in this case flows through 2 electrodes, and it's able to reach a temperature which is around 42 degrees, but the action is very superficial. So we are not able to heat cellulite and to heat fat. On the contrary, Onda is able to heat the fat, melting the fat, at the beginning skipping the skin. Then this heating will start to spread all around, and that's explain the action even in the area which has not been treated. And at the same time, it will go up, involving the dermis, involving the epidermis, and so giving me a triple action on fat, cellulite, and skin tightening. Let's see the comparison with ultrasound. Ultrasound is able to heat the fat, but in reality is able to go over, so to heat muscles, to heat bones. So we normally have to use, well, low power are allowed. Otherwise, the system could be dangerous. On the contrary, thanks to the high permittivity of the fat, Onda is able to heat the fat, melting the fat, but the microwaves are not able to cross the fat because the fat acts like a sort of shield to the passage of the microwaves. HIFU is another technology which focused its action on the fat layer. The problem is that the area we can treat is very, very small. On the contrary, the heating that is produced by DECA spread in horizontal, and it goes up to the dermis and epidermis. So again, the triple action. And let's see the comparison with cryolipolysis. I have to confess that we love cryo, and we have cryo in our clinic. The problem of cryo is the selection of our patient. Why? Because this system cannot be performed in patients in which the tissue is not pinchable, because the vacuum is not able to suck the tissue. So when the tissue is very hard, for example, in the trochanter area, cryolipolysis cannot be performed. So that's why, and there are also other problems with cryolipolysis, because we don't treat skin laxity, we don't treat cellulite. So that's why we can eventually combine the two treatments. So if my main anesthetism is the fat, I can perform 1-2 sessions of cryo, and then if I'm satisfied with the loss of volume, I can stop the treatment. Otherwise, if I observe a visible amped skin, I can start with 2 sessions with Onda. Or if the main anesthetism is a fibrocellulite, so the tissue is very, very hard and it's not pinchable, I can start with 2-3 sessions of Onda, and then I can perform a treatment when the tissue is pinchable. I can perform 2 sessions of cryo. But I have to confess that Onda it's very effective in her triple action, even if it's used alone. Well, let's see a brief video. This shows you how the treatment is simple. At the beginning, we have to take pictures of our patients, because patients do not remember how they were at the beginning. In different projections, you see we have lines on our floor in order to continue to measure in the same place. Then we have to measure our patient. We take a plica, and this is an important data because we have to insert the measure of the plica in the machine. We draw the area to treat, so square 15 by 15. Consider that we will have an improvement even on the adjacent area. We select the sex of our patient. We select what we want to treat, the area. We insert the plica, and we will have the right parameters. Well, at this point, I switch off for a few seconds because I would like to make you understand better what is the power, what is the dose. Maybe some of you are familiar with these devices, but for others is the first time. So what is the power? What is the dose? The power is the strength that I put in place to push down my microwaves inside of the tissue. The dose is the energy that I want to deliver. The power is an energy on time. So if I increase the power, I will decrease the time. If I increase the dose, I will increase the time. So it's a balance between the power and the dose that will give me the time. But to make you better understand with a very stupid example, we can compare the dose that we want to irrigate to the dose of a drug that we want to inject through a syringe inside the tissue. So while my power instead, it will be the strength that I put in place to inject my drug. So if my strength is very high, even the time in which I inject my drug will be short. If I increase instead my dose, even the time will be higher. For a good treatment, able to heat the fat, melting the fat, thermally solubilize my collagen, and have an improvement in skin quality, we saw that we need about 15 minutes. It's important to maintain the temperature at 5 degrees because it's the temperature that is able to stop the rising in temperature. And at this point, we can start with our treatment. Well, it's important how we put our patient. We have to not to lay down completely. We have to find a sort of natural plica. We spread the oil, and we start to perform the treatment. You see the red light means that we are not in contact. The yellow light means that we are delivering half of the energy, so we have to fix our position. The green means that we are working in the right way. So we will start to perform linear movements and large movements. It's important not to stress too much our wrists, so we normally hold the end piece like a pen. It's important to slide passing several times in this square 15 by 15, all our dose and with a particular power. And it's important to avoid the bones, and it's important to avoid the belly button because this is a cavity, and the temperature in this area will increase very fast, but it's very difficult to cool it down. It's not necessary to go too fast. It's not necessary to go too slow. So an appropriate speed. Eventually, we can go faster if the patient do not tolerate our treatment. So avoid the belly button. Well, in case the patient will not tolerate our treatments, we can, before reducing the power, before reducing the parameter, we have to add some Vaseline oil. We can go faster. We can eventually switch off and slide only the cooling. If the patient continue not to tolerate our treatment, we have to decrease the power. What is important to know is that our patient at the beginning of the treatment will perceive a cold sensation. Then when we use the shallow end piece, the heating will be perceived after 3-4 minutes from the beginning of the treatment, while if we use the deepened piece, the heating will be perceived 5 minutes before the ending of the treatment. So to imprint in your mind what is important. First, select the area to be treated so as to take advantage also in nearby location, because remember, we can treat no more than 6 squares because we don't have to stress too much our lymphatic system. Second, what is important is to increase the parameters. The parameters that you find in the protocol manuals are safe parameters. They are effective, but if we want to maximize the effectiveness of the treatment, we need to increase the power by 30 watts, the dose by 70 watts. And so we will have an average duration for a good treatment, which is around 15 minutes. In case of discomfort, important before reducing the parameters, add some Vaseline oil, go faster, cool by switching off the end piece, and reduce the power at the end if the patient do not tolerate. In case of cellulite 1 and 2, we normally suggest the patient to perform at the beginning lymphodrainage massage, because in this kind of cellulite, we have a lot of water. And so the water can absorb the microwaves. So even the effectiveness of the treatment will be less. In case of cellulite 3 and 4, it's important to start with the shallow end piece for the first 2 sessions and then to shift to the deep one. What we have to know. It's not recommended to hydrate the skin before the treatment to avoid loss and dispersion on the hydrated tissue. It's important not to treat more than 6 squares and an interval session less than 4 weeks, because we don't have to stress too much our lymphatic system. It's important to avoid the treatment of the belly button, because this is a cavity and we reach a very high temperature, but we are not able to cool it down. Avoid the mental bones, because this is an area in which there are a lot of nervous structures. It's important to perform linear movements and not circular movements, because we have to cool the temperature down. It's important to stay always in motion, so not to stay still, otherwise we can damage. And it's important not to perform the treatment in case of abdominal hernias or diastasis. So I think that the most amazing aspects, again, is the triple action of this system, but the system can be, has the possibility to, we have the possibility to customize the treatment, depending on our patient, depending on what we have to treat, and during the following treatments. Now I'll show you some clinical cases. You see the reduction in panniculum after 4 treatments. And here you can see after 2 treatments, the improvement in skin quality and the reduction in the loss of circumference. And you can appreciate this if you look at the grade board, which is behind the patient. So you see that the distance between the line of the square and the tissue and the body of our patient increase in the following in the second picture. Again, you can see a loss of circumference of 2 centimeters after 2 treatment sessions. The improvement on the upper knee, on the skin quality of the upper knee after 2 treatment sessions. Again, the improvement in cellulite, the improvement in skin quality in general after 2 treatment sessions. And again, you can see the loss of circumference in the trochanter area after 2 treatment sessions. The improvement in cellulite after 3 treatments. And again, the loss of circumference after 4 treatment sessions. What is important to know is that even if we suggest 4 treatment sessions, we'll have an improvement even after 1 treatment. You see here the loss of circumference of 2 centimeters after 2 treatment sessions. And again, you can appreciate the improvement if you look at the grade board behind the patient. Again, the improvement in skin quality and loss of circumference of 2 centimeters for each leg. And again, the improvement in skin quality only after 1 treatment session. Improvement in cellulite after 1 treatment. And a loss of circumference of 3 centimeters. Improvement in skin quality. And you see even here the improvement in skin quality after 3 treatments. Again, the improvement in the upper knee after 1 treatment. And again. And again, the improvement with a loss of circumference of 3 centimeters. Also in this case, we had an improvement in cellulite. We had an improvement in skin quality in general and loss of circumference after 3 session treatments. And again, a loss of volume or a loss of circumference of 3 centimeters after 4 treatment sessions. Again, you can see the good results even after 3 treatments. And again, a loss of circumference after 3 treatment sessions. Loss of circumference of 4 centimeters on the left and 2 centimeters on the right after 4 treatment sessions. And here you can see the trochanter area and the reduction in volume of this area. The treatment of the banana line after 1 treatment session and the improvement in skin quality. Improvement in cellulite and tightening after 2 treatment sessions. Again, the improvement in cellulite and tightening result after 1 treatment sessions. Improvement in tightening. Improvement in tightening and even loss of circumference. And the improvement in cellulite. Well, let's see the abdominal area. The abdominal area can be treated performing 1 square, 2 squares, or 4 squares. And here you see that we had in the second image, we had an improvement of the skin quality in the upper part of the belly button, but we even had a good improvement on the flanks. So we have an improvement even of the area which is around the area that we are treating. Eventually, it's possible the combination with the fractional CO2 laser. In this case, we can perform at the beginning the treatment with fractional laser, and when the skin is completely healed, we can perform the treatment with Onda, or we can start with Onda and we can perform the treatment with fractional CO2. In this case, the treatment with fractional CO2 can be performed even the day after. Here you can see the reduction in circumference, 9 centimeters and 5 centimeters, and tightening result. Again, the loss of circumference and the improvement in skin tightening after only 2 treatment sessions. This is a very nice picture in which you can see the improvement of the bra line with a loss of circumference of 2.5 centimeters after only 1 treatment session. And also here you can see the improvement, the loss of circumference and the improvement of the flanks. Also in this picture, you can see the improvement in skin quality. So there is a reduction in these lines that you can see in the first pictures. And the improvement around the wrinkles that are on the belly button. Even in this picture, you can appreciate it after 4 treatment sessions. And here you can see these lines around the belly button. It seems to be a sort of a reversible V, but in the second image, the lines are more horizontal. Again, loss of volume and improvement in skin quality. And again, loss of volume and tightening result. In this patient, 4 squares were performed. And we also had an improvement even of the flanks. And you can see better in this image the improvement. Also in this case, we had a loss of volume and tightening result after 1 treatment session. And even here, you can see the reduction in wrinkles in the upper part of the belly button. Again, the improvement in tightening. We often use this system, Quantificare. This system can give us the 3D images, and this system permits us to calculate in the right way the loss of circumference and the loss of volume. So you can appreciate that we had in this case a loss of circumference of 56 millimeter in the upper part and 36 millimeter in the lower part of the abdomen. Another area that can be treated using Onda is the arm. We normally use the shallow end piece. The treatment normally are rescheduled after 3 weeks. And you can see from the picture, we had a good tightening effect even after 3 treatment sessions. Well, recently, DECA, in order to respond to the request of customers, well, it increased the field of application of Onda even to the treatment of the double chin of the submental area. This is a very delicate area, so we have to avoid the treatment of the bones because in this area there are a lot of nervous structures. So we have to stay below 1.5 centimeter from the lower mandible border, and we have to avoid the thyroid notch. Thanks to the uploaded of the software, we have in the body contouring area, we have even the treatment of the submental area. The machine will give us these parameters. These are safe parameters, we can increase them, but at the beginning, it's better to start from these parameters. And then when you are more confident, we can increase them. We only use the shallow end piece. This is the area to treat, the area to be excluded. The interval between sessions is normally 2 weeks. We normally perform 4 treatment sessions. The power can range between 20 and 60 watts, and the dose between 20,000 joules and 50,000 joules. Here you can see the improvement of the laxity of the skin. And here this patient had a very important loss in weight. So she had this laxity and localized adiposity. So after 4 treatment sessions, she had this improvement. You see better from this image. Again, you can see the improvement after 4 treatment sessions. And this is a 65 years old patient with this skin laxity and the improvement she had in the second picture. This is a video how we perform the treatment with Onda in the submental area. We use the shallow end piece. It's important a correct coupling. It's important to avoid the thyroid notch. It's important to avoid the mental bone, so to stay 1.5 centimeter below the mandibular bone. These are the parameters that we have used. So 40 watts and 50,000 joule. So we continue to perform the treatment until we have completely delivered the dose. You can see the patient, she does not feel pain. The treatment is painless. It's important the correct coupling. You see the green light. So if it's red, it means that we are not in contact. If it's yellow, we have to fix better our position. Well, I finished my presentation, but I would like to underline the fact that this device is amazing because of his triple action on fat, cellulite, and localized adiposity, and skin laxity. And it's possible using the same platform, using the same NPs, using the same parameters in the same time. And the results are can be observed even after the first treatment. So it's very unique. And thank you for your attention.
Thank you, Dr. Michela Troiano, for this exceptionally fantastic, allow me the term, to use part of the explanation with practical protocols, tips and tricks on how to behave in front of our patients. Well, as usual, we're being overwhelmed by a lot of questions. We have more than 100 in this moment. I will try to do all of my best to split them in two parts, particularly for what it concerns the theory related to the fat cell behavior and the biology related to the fat tissue, out from what other instead are mostly related to practical protocols, to the operation to perform on the patients, the manage of the patient, and of course, what to do when and what to do before, what to do after. So we start the group of questions with Professor Paolo Bonan again. And the first questions we have been asked, it's about the interaction of anti-inflammatory substances. The question is, actually, is there any effect of anti-inflammatory medication, for example, NSAIDs, towards the blebbing phenomenon and the results of the ONDA system?
Yes, very interesting questions. And I think that it's better not to use fans during the treatment because we can interfere with the cyclooxygenase pathways and products like prostaglandins 2, and so you can reduce the positive inflammation due to the arrival of macrophages and monocytes. So it's better to finish any kind of anti-inflammatory treatment because we could interfere with the process that lead to the reduction of the adipose tissues.
Thank you so much, Professor. And the next question is about the fat tissue biologic behavior. One of our guests is actually asking, my understanding about the fat is that we do have a certain number of fat cells in our bodies. We might lose them every year in amount of a 10% or so, okay, and the blood and the body replaces them. So the new adipocytes are pretty much healthy. Are we using the ONDA, or we might use the ONDA to expedite the loss of natural fat cells removal?
Yeah, actually, we have a coverage of our treatment, our experience in 3 years. But our goal is to reduce the adipose tissue in size of the cells and number of the cells. And up to now, so far, we have seen that we don't have any further increase after the treatment of the adipose tissue. So it's a sort of quasi natural effect in losing the fat, and so is not healthy. Is healthy, very healthy, but we are capable to reduce the stubborn fat and then maintain these results in a very natural way.
Sounds great. And the last question about biology about of the fat tissue is about the triglyceride. If you can please explain once more about the mechanism of splitting between glycerol and fatty acids inside of the triglyceride molecule.
Before we conclude our my part of question and answer session, let me thanks once again Simone Parenti, our moderator even today. And the triglycerides are our molecules. The molecules are the dipoles. The energy is capable to arrive directly in the fat cells, and the focus is in this kind of molecules that respond better than the other. They are more sensitive. The heating is capable to divide the triglyceride molecules in one molecule of glycerol and 3 of free fatty acid. This process leads to the imbalance between the phosphorylation and oxidation. So this is a continuous process starting from the heating of the molecules that are represented in this case by the triglycerides. Then we have the cascade of events in the membrane and the consequent release of droplets. They arrive on monocytes and macrophages, and we continue the process in the lymphatic pathway.
And this is good either, Professor. So now we are slightly shifting to what is more concerning the practical side of the use of ONDA, with question mostly related to protocols, mostly related to the behavior to have in treating the different side of the body that are object of the session of ONDA, and we will do this with our other speaker, Dr. Michela Troiano, that will drive us through whatever is practice for what it concerns the use of the system. One of the first question about the protocol is actually concerning the maximum number of the areas that are possible to treat with the system. Can you please remind us how many areas maximum we have at our disposal for the treatment?
Okay, so normally it's recommended to perform no more than 6 squares. This because we don't have to stress too much our lymphatic system. So it's important to select in the right way the area that we want to treat. Because if we have a very huge leg, for example, we have to perform 3 squares for each leg. So we have to rightly select the area to treat, and we have to remember that we will have an improvement even in the adjacent area. So we will have an improvement of the whole leg, but no more than 6 squares.
Thank you so much. May you please recommend to use all of the 6 areas that you mentioned to us before instead of splitting the 6 areas in lower amount, treatment by treatment?
I'm sorry, Simone?
I said, do you recommend to use as a maximum all of the 6 areas that you recommend as to be the maximum available areas to use instead of use lower, for example, 3 or just 2 areas at a time in order to do the treatment done?
Well, we can perform even less than 6 treatments, but in total, no more than 6.
Okay. Other question is about the lymphatic drainage message that we are actually practicing in between sessions and at the end of the entire course of treatments. Can we perform the lymphatic drainage only manually, or other kind of units or equipment are allowed to do it?
Yeah, sure.
Okay. When we're talking about the treating, the square here per session, and are we talking about all of areas that are positioned close by one each other, or can they be splitted all over the body, or whenever is it necessary the patient to be treated?
Well, we can perform the treatment in the abdomen area, and we can treat in the same session even the trochanter area. But when we treat, for example, the abdominal area, we are sure that we will have an improvement even of the flanks.
Okay, that's good. Still talking about the lymphatic drainage technique, these maneuvers shall be prolonged for pretty much time. I mean, trying to give numbers, 30 minutes, 15 minutes, 2 minutes, 10 minutes. Can you give us a sort of little indication about it?
For the lymph drainage?
For the lymph drainage, of course.
Okay. Well, normally about 15 minutes for each side.
Okay, that's good. Can you please just remind us, for what it concerns the synergy between cryo and Onda? Can you please put some light about it?
Okay. Well, as I told you before, the cryolipolysis is a very good treatment, but the main anesthetism in this case, it's a fat, and it's only able to treat the fat. It's not able to treat a tissue which is not pinchable. So that's why we can combine eventually the cryolipolysis with Onda. So in case the tissue is very fibrous, we can start with Onda in order to make the tissue softer, and then we can perform the treatment with cryo. Normally, we have to wait between cryo and Onda about 2 months. Yes, 2 months.
Okay, that's good. In case, for instance, still talking about this topic, in case of an obese patient, of course, how can we manage the expectation in case we are requested to met as much as fat as possible?
Well, I think that it's great the possibility of Onda to have this triple action. So to maximize the effectiveness on the fat, we have to increase power and dose. But at the end of our treatment, the patient will be very satisfied because she will have even an improvement in cellulite and skin laxity. So an improvement of skin in general.
In case, for example, we have a patient that has both fat and cellulite, is it better to work with the fat first and then with cellulite, or vice versa?
Well, it's the same, because in reality, the parameters we are using are effective for both these situations. So it's not necessary to start thinking to treat at the beginning the fat and then cellulite, because in reality, we will have the same effect with the same parameters. So treatment of fat and cellulite in the same session.
Is there any kind of discriminant in between the cellulitis degree, or it's always the same story?
No, it's not the same story, because if we have a cellulite 1 and 2, we suggest to perform lymphodrainage massage in the beginning and then to start the treatment with ONDA. Instead,
Okay.
when we have the cellulite in stage 3 and 4, we normally start with the shallow NPs, because the narrower diameters permit us to concentrate more our energy power.
Sounds great. Do we have any particular warnings about the overlap that naturally the handpiece perform over the 15 per 15 centimeters area?
Well, it's important to move with linear movements and to perform larger movements. So not very, very close together. We don't have to insist to overlap too much in the same area, because otherwise we can damage. So larger movements, but we have surely to completely cover the square.
That's good. This is a question instead about particularly talking about a protocol. Okay, that means these gentlemen is actually asking us, if I give a certain amount of energy with a certain amount of power in 10 minutes, may I dilute the time of treatment in 15 to 20 minutes by appropriate dose and power changing? I mean, the efficacy is still the same.
Well, in reality, in our experience, we saw that the right time to perform the treatment, to have a good improvement in fat, to have a good improvement in cellulite and in skin tightening, it's about 15 minutes. So we have to increase the power, we have to increase the dose.
Okay.
So it's our safe parameters, are good parameters, but if we want to maximize the effectiveness of the treatment, we have to increase power, dose, and so the time, because the time is a balance between the power and the dose.
Okay. My Onda actually has the old type shallow handpiece. We're talking strictly about a product configuration. Can these shallow handpiece be used for the submental area?
Well, it depends on the handpiece you have, because we have recently the handpiece has a particular shape. So if you have this particular shape, you can even treat this area. Otherwise, you can find a correct coupling with the tissue, and it's important to upload your software in order to reduce the parameters. But you can ask to DECA.
Actually, just to complete, if you allow me, this kind of more technical oriented question, actually the old shallow handpieces type, they have two main obstacles that prevent them to be used over the neck area. One is the shape and the weight. One is actually, as Dr. Troiano was mentioning to us 1 second ago, the software that it doesn't allow to dispose of the proper protocol. So the answer might be said as a no to use the OnDA system on the submental area. We'd like rather to upgrade the old system. This is technically possible to the new handpieces in order to benefit about the software, about the new shape of the handpiece, and also about the new coupling device, as Dr. Michela Troiano told us before. Can we perform DECA ONDA right after cryolipolysis?
Yes, sure, you can perform at the beginning cryo, and then you can start with ONDA in order to improve the skin quality of our patient. If you have both of them, you can do this, but even ONDA alone is great for treating localized adiposity and then cellulite and skin laxity.
Still talking about the operating protocol, when we do the treatment, it's important to use a thermometer to check the temp of the skin?
No, it's not necessary. We can do, but it's not necessary if we perform the treatment in the right way. The treatment is safe. We can touch the skin of our patient. At the beginning, it will be cold, but then after 3-4 minutes after the beginning, if we use the shallow, we will start to perceive the heating. While if we use the deep one, we will start to feel the heating 5 minutes before the ending of the treatment. So we can even touch the skin. But if we set, what is important is to set the temperature at 5 degrees. And if we don't insist too much, performing movements in the same line, it's a safe procedure and we don't need to check with a thermometer.
Okay, this is quite a nice one. Is it okay to perform treatment over 6 areas today and then tomorrow to perform another treatment on other 6 areas or less, but in a different location? Okay, for example, today 6 areas on tummy and tomorrow 6 areas on legs. Is that possible to behave like this?
No, it's not recommended because the lymphatic system, which is the system that has to eliminate our inflammation, needs time. So we have to wait. We have to wait about 4 weeks if we use high parameters such as in case of fat and cellulite.
That's good. This is pretty related to the percentage of fat loss expected, or if we have any idea of the number of sizes that we might lose in that's the big question. I know that's the big
I would
question.
like to know the same thing.
Yeah, in the entire course of treatments, in the whole 4 sessions.
Well, it depends. It depends because it depends on the body type, and it depends on the quantity of fat of our patients. So it's too difficult to answer to this question.
Okay, tricky one. Is it allowed to use Onda on male chest?
No. So we have to stay far about 2 centimeters from the chest. Okay, we have to treat the abdomen, and we can, if our abdomen is very huge, it's very big, we can perform 4 squares. Otherwise, we can perform 2 or 1 squares. It depends on the body type.
Anything that has to do with cardiac area or any kind of vital potential located organs is actually being avoided by regulation, so that we cannot use Onda over female breast or male chest, whatever it might be, far from the cardiac area.
About 2 centimeters from.
Yes. When we treat over the submental area, do we need to make any measurement before? I think it's relating to a kind of pinching or whatever that may give us the idea on the fat amount that we have to deal with.
Well, we only took pictures of our patient.
Okay. All right. Do we have to exercise right after the Onda treatment?
Well, it should be better.
All right. Okay then. Can we remove the fat and tighten the skin at the same time?
Yes, this is what is important to underline, that we have in the same session, we can have the improvement in fat, but we can also have the improvement in skin quality and cellulite.
Okay. Let me complete to the question to these the same doctor that is asking about the fat and tightening, at the same time saying that, as we said previously, the previous handpiece from the last year version of Onda has to be upgraded with the new devices and new software that we have been implementing from these may on in order to be able to treat the submental area. Another nice question. What is or what are the post-ONDA practices or home care routines that must be adopted by a patient?
Well, we can suggest the patient to drink a lot of water, to make lymphodrainage massage, to do exercise, but there is nothing in particular to suggest. The patient can do everything. There is no pain after the treatment. There is no discomfort, such as for after a cryolipolysis, for example.
We have a question that came in right in this second, okay, from Eastern Europe. What about ONDA and male breast? I think partially we have already answered a few while ago.
So it cannot be performed in the breast area.
All right, this is pretty nice one. Okay, when we're using derm pencil and
In
using
where, sorry?
when we're using the derm pencil to delimitate the 15 per 15 areas, and then we're using paraffin oil, we observe a disappearance of the white lines of the squares. And then we're using some kind of other standard big pen in order to have more visible area, but then it might be a nightmare in removing them after the treatment. So do you have any advice about it?
Well, we can use the white pen, or eventually we can, sometimes we use even the epidermal pen, and the color remain. What is important is to cover the square. Sometimes we can go a little bit over the square, but consider that in the periphery of the handpiece we have the cooling system. Well, I don't have a particular pen to suggest to you for this.
Okay, I have a question that came in onto my desk now in the second in time. It's talking about what is the maximum power and dose recommended?
Well, well, it depends what we are treating. For cellulite, to maximize our effectiveness, we can work with power of 160, 180 watts, and a dose around 160,000 joule. For fat, we can treat with power of 150, 160 watts and 1,050,000 joules. For the skin tightening, for example, for the treatment of the arms, we normally use 150 watts, 140, 150 watts, and a dose of 100,000 joules. So we increase, if you consider the parameters that are set by the machine, you can increase the power by 30 watts and you can increase the dose by 70%.
There's another question correlated to this previous one. For double chin, how can you know what dose and power are correct?
Well, I have to confess that we are using since 4 months, so we suggest to start with lower parameters, and then when we are more confident with this treatment, to improve it. Normally, it ranges between 20 and 50 watts, again, more or less.
It's very important to monitor the patient constantly, I might add, because Instead of having absolute values in both energies and power, we always must take care about the condition of our patients. What I want to say is that it's a good practice every once in a while during the treatment, as Dr. Troiano has been detailing to us before, to ask the patient, how do you feel? Can you tolerate it? Is it too hot? Is it discomfort in any means? So that you might adjust about the levels of both power and I shouldn't say the energy dose, because the energy dose has to be kept fixed in mostly of the way, as Dr. Troiano taught to us previously in the management of the trouble during the treatment. But this is the way how to better determine which could be the most higher parameters we have adopted for that patient in that particular moment in time. There's another question, Dr. Michela, about the cellulite results that you have been showing us before. There's a very heavy, in one of the first cases, there's one heavy case in which with by only 2 sessions, the patient would be improving drastically. Okay, so several of our listeners are asking us what kind of parameters we may adopt in that case. So when cellulite is heavy, how we can behave in order to have a fast and effective result, of course.
Well, we have to use a power which is around 160, 180 watts, and a dose which is around 160,000 joules. This is a good parameters to have a good effect. As Simone was saying, it's important to ask to the patient if the patient can tolerate. We can eventually increase the dose, but at this point, we have to increase even the power. And if we increase too much the power is responsible of the heating sensation and sometimes of the discomfort of our patient. So it depends on how the patient can tolerate the treatment. But these are good parameters for cellulite.
There's a couple of questions coming from the same geographic region. One is about double chin, and they're asking the recommended parameters to avoid discomfort. Can you please repeat them if you don't mind?
So 20 watts and 20,000 joules.
The other question coming from the same point is for heavy cellulite, okay? Can we merge other techniques together with Onda?
Yes, surely. You have the possibility to customize the treatment, but Onda alone, it's enough to resolve the 3 blemishings.
This is an excellent question, if you allow me to say so, for you and Professor Bonan, to be honest. And this is saying about the use of the CO2 for laxity, how many sessions, and how we apply the laser in conjunction with Onda.
Well, in the case I show you, only one treatment session with the fractional laser was performed and only one treatment session of Onda. But we can even continue to treat the patient. What is important is the interval between sessions, because if we treat at the beginning with fractional CO2, we have to wait about 2 months. We have to wait the completely healing of the skin, and then we can perform the treatment with Onda. Instead, if we start with Onda, the treatment with CO2 laser can be performed even the day after.
Interesting question for Northern Europe. Cellulite, how long can we expect the treatment last? And if there any experience on how to often to treat to maintain the good results?
Okay, so considering that, as I told you in one of the slides, it depends on the body type, because if my patient is a normal type patient, I can perform 2-3 treatments. If my patient is overweight, we will perform 4-6 treatment sessions, but an average of 4 treatment sessions. Normally, we recall the patient after 3 months, and we perform maintenance treatment every 5 months, after 5 months.
This is interesting too, actually. Coming from other side of the globe, do you do a different slimming treatment on the same day with Onda or on a different date? And in this case, how many days is the interval?
I'm sorry, Simone, the interval between?
Between different slimming treatment together with Onda in a synergistic use with Onda.
Well, we normally use only this device at the beginning. I mean, in the session, we only use Onda, and then we perform other treatment with other devices in the following days, but not in the same session.
I beg your pardon, and I would like also to remind that Onda is not a slimming machine, so we can use some kind of other slimming means, but in full respect of the body of the patient. Onda aim, when we talk about localized fat adipositase, is to give harmony to a patient's body, is not to make him to get slimmer after 1, 2, or I don't know, 5 sessions. That's the main purpose of Onda. Additionally, as our speakers have been many times added today, we might intervene with other kind of practices. They might be devices, they might be diets, they might be exercise, all completed by water drinking for a minimum or 2 liters or so that we can maintain and we can smooth all of the efforts that both the practice and the machine has been put over the field. Another important questions about the education of the patient. Now we are going a little bit slide from the simple practice, but this is fully included into this. The question says literally so. Our patients are asking us results after 1 day. How's the best education policy in this case?
Well, after the treatment, we normally suggest to drink a lot of water, to make massage. Of course, is also important a correct diet. But the patient can do everything after the treatment.
Okay, then. Mostly, most of the requests, I think one of the comment behind the question is that most of the request comes from patients that want to be treated today and they want to see their body change tomorrow morning. They don't even give time to the fat to be either eliminated or simply reduced.
No, sorry.
No, go ahead. That's the main concept.
So to see a good result, we have to wait till 2 months. We have to wait. We have to give to the body the time to and the different cells and the lymph drainage system to have their effect.
Absolutely correct. Okay, now we are running to the end of the webinar. Before we end that, I would like to propose to all of our audience that is still fully present, and we thank you from the very deep of us at this webinar, a little questionnaire which we will have a double check about the flow of information that we try to share with you today. Okay, that's the first question. I invite all of you to answer. Why does Onda uses microwaves? We have 3 answers: for proper selective action of skin only, for proper selective action on the visceral fat, for proper selective action on the subdermal fat. Let's see the answer. We have just a few about Well, I have to congratulate to our speaker because the majority of all of our audience has been clicking on answer labeled with C for proper selective action on the subdermal fat. Then we have another one. What kind of effect does ONDA generate? It breaks adipocyte, start macrophage adipolysis, and so initiate the action. It empty adipocytes for just enough time and then replenish them. I apologize for the cut of the graphic, but it depends on the number of space that we have here in this lines. It makes the patient to gain weight. As we want to have 100% on the breaks adipocytes, start macrophagic action, and so on. Congratulations, everyone. Let's proceed ahead with the third one. This is pretty tricky in a way. The cupping fluid that we are using with ONDA. We have mentioned during presentation about the interference that microwave might have with specific means. So actually, the three choices are water-based gel, Vaseline oil, paraffin oil, or water gel. Well, actually, doctors, we have to congratulate with you all. Vaseline oil is the correct answer. Good. Then fourth of 5 question. Why is ONDA emission safe? We have been discussing pretty deeply today about this method. So the 3 possible answers are handpieces control emission, contact, and cooling. So a real-time emission on all of the 3 features. Handpiece deliver only when feeling fat, very sensitive ones. Handpieces deliver only by foot switch. That's it. Well, theoretically, we should wait a little while because we should give the statistic tool to give all of our results. But I have to say, and I have to share with my speakers, that all of you are answering correctly. Congratulations. And then last question before we finish the webinar today. Why should I get ONDA instead of other technologies? Because it can treat all of the 3 body shaping disciplines, fat, skin laxity, and cellulite. Because it's more beautiful than others, maybe. Because it can treat fat only with no pain. And the result is the first one, because it can treat all of the 3 body shaping disciplines. Congratulations, you all. So before we turn the screen off, let me thank you, my speakers. Firstly, let me thank you, Professor Paolo Bonan, for the incredible research and medically detailed presentation of the biology and physiology of this recently new discovered organ, the fat tissue, that is full of blood circulation as adipose tissue and all physiological, biological reaction in order to be a sort of growing up organ independently. But let me thank you also, Dr. Michela Troiano, that has been driving us so truthfully over the protocols, the details, the secrets, and drove us through how to behave and using ONDA and what to discriminate. Very important and so rare nowadays, especially when we might learn all of this kind of information that are not present traditionally over some kind of both operating and clinical manuals from companies. Let me thank you also, Mr. Vincenzo Di Miola, that been assisting us so carefully in the technical aspects of the webinar. But let me thank you all for your constant attentions, incredible number of questions, and high level of details of all of your inquiries today. For what it concerns myself, let me thank you again, everyone. Say goodbye and see you next time at the next webinar from DECA on Luxia multi-platform on June the 11th. Thank you very much, everyone.